All right, let's jump right in. Today, we're going to break down a huge shift in how rural healthcare gets funded in Pennsylvania. If you're a hospital leader, what we cover in the next few minutes is going to be an absolutely critical roadmap for what's coming your way.
So let's just start with the big number, right? Nearly $200 million. This is the initial pot of money that Pennsylvania has locked down for its new Rural Health Transformation Program. And frankly, it's a significant award that puts the state way ahead of the curve.
But here's the catch, and this is important. This isn't just a simple grant. You should really think of it as a strategic cushion against a major financial storm that's on the horizon. This money is designed to be transition capital, not some permanent subsidy to keep doing things the old way.
And here's why that distinction matters so much. This new funding, it's only designed to cover about 37% of the federal Medicaid cuts that are projected to hit. So the state is basically sending a huge signal here. Use this money to change, to evolve, because the financial ground is shifting for good.
So how do you navigate all this? Well, here's our game plan for today. We'll kick things off with the billion-dollar mandate. Then we'll introduce the new power brokers you absolutely need to know. After that, we'll break down the two main paths to get funding, how you'll be scored, your application timeline, and we'll wrap up with some specific strategies for your hospital.
All right, Section 1. The big takeaway here? The old way of doing business is officially over. This program isn't just about asking for money, it's about forcing a fundamental rethink of your hospital's place in your community.
So, on the left, you see the old way, right? You dealt directly with the state in Harrisburg. Forget that. That's gone. The new model completely flips the script. Power is shifting locally, and you'll now be working through these brand new regional groups called RCCs.
Okay, so let's meet these new gatekeepers. Honestly, understanding who the RCCs are and how they work is probably the single most important factor for getting our hands on this funding. So what exactly is an RCC? Think of them as the new local committees. The state is setting the broad funding categories, but the RCCs, they're the ones who will be looking at project ideas and, ultimately picking the winners in your region.
And take a look at who's sitting around this table. It's not just hospital folks. You've got county commissioners, business leaders, FQHCs, a whole mix. These are the people you need to convince now. They are your new primary audience, and they are your required partners.
And this really hammers the point home. The strategy is simple. You have got to get a seat at that table. I mean, if you're not on the main government's board, or at least an advisory subcommittee, you're on the outside looking in. Your projects could get totally overlooked while your competitors get funded. All right, let's get to the money. How is it all structured? Now, officially, there are 6 grant categories, but really, for strategic purposes, you should think of it as 2 main paths, and they have very different goals and, importantly, very different application processes. So here are your 2 funding streams. Path 1, which is called the RRASP program, is like the ER. It's for survival, right now. It's for immediate needs, and it's handled directly by the state. Path 2, that's the long game. It's for transformation, for thriving down the road, and that money flows through those regional RCCs we just talked about.
Now, if you want to access that immediate stabilization money, you have to be in pretty serious distress. This isn't for every hospital. We're talking less than 60 days cash on hand, or, you have a documented plan showing you're on the verge of closing a critical service line without some kind of intervention.
Okay, so let's move on to the bigger pot of money, the transformation grants. This is a competitive process. Your application is actually going to be scored, so you need to know exactly what the judges are looking for.
Okay, this part is absolutely crucial. You have to explicitly connect the dots between your project and these state targets in your application. Don't just say, hey, we need money to hire more nurses. No. You need to propose a plan that reduces vacancy rates by 10% and includes a 5-year service commitment. That signed MOU with a local FQHC, it's not really a suggestion. It's pretty much a requirement. And you've got to move on this. It's a competitive process, there's a clear timeline, and it basically starts now. So let's walk through the key phases so you can get your team ready to hit the ground running.
So as you can see, you need to be acting right now. The first part of the year is all about prep work, gathering intel, figuring out who's who in your region, getting your data together. Then, if you're eligible, you apply for those stabilization funds. But spring? That's all about building those critical partnerships before you even submit your main concepts to the RCC.
All right, so what does all this mean for you, for your hospital? Well, your strategy is going to look different depending on your situation. Let's quickly run through 3 common scenarios and what your game plan should be. Okay, scenario A. You're a hospital in distress. Maybe you're facing a real, immediate crisis.
Your strategy is simple. Survival first. You go for those RASP stabilization funds to get an immediate cash infusion. That buys you some breathing room to figure out a new, more sustainable long-term model, like maybe converting to a rural emergency hospital.
Scenario B. You're a regional hub. You're one of the larger rural hospitals in your area. Your strategy is to become the absolute, indispensable anchor for care. You could lead the charge by applying to become a maternal health hub, while also tackling that constant recruitment crisis by using funds to build student housing for new residency programs. And finally, Scenario C. You're part of a bigger health system. You can use this money to solve those nagging system-wide problems. For instance, building a crisis stabilization unit to finally deal with psych patients boarding in your ER, while also creating a scholarship-funded talent pipeline that commits new graduates to your rural campus for 5 years.
So when you boil it all down, this whole billion-dollar program is really asking every single rural hospital leader in Pennsylvania one simple question. Are you going to be a passive recipient of change, or are you going to step up and be the architect of your region's healthcare future? The funding's on the table, but it demands a whole new way of thinking. The choice, really, is yours.